So this is Dr. Van Rieken. You're about to see a video of Sean getting some platelet-rich plasma, or PRP for short, into the scalp for hair loss. And if you wonder how effective this is, it's variably effective, more effective than women and men. One treatment is sometimes enough, because if you fast forward to the end of this video in the last 30 seconds or so, you will find that he's had a nice result, and you can see his temples with significantly more hair in his before and after pictures, which will be side by side at the end of this video. Dr. Calvin Van Rieken at Reno Sparks MedSpa in Reno, Nevada, and I've got my volunteer Sean here who wants to get some more hair. Why do you want more hair, Sean?
I just want to be bald by 30, so let's try to tackle this now.
All right. And so there are various things you can do for decreased hair. Basically, there are two types in men. There's male pattern baldness, which is inherited through the mother's side. And then there is alopecia areata, where you have sort of spotty hair loss, where it might be normal in one area, and then you've got a spot that's kind of thin. So you can have both. You can have neither. When you have male pattern hair loss, it tends to be more in the temples, a little bit in the sides here, and then in the vertex or crown, kind of on the top of the head. Whereas if you look at the occipital, or sort of the posterior area near the neck, and for a couple inches, 3-4 inches above the neck, there tends not to be too much hair loss here. It's a little different pattern that you have in women. When women lose hair, it tends to be diffuse, not so much temples, but just kind of the whole area, but their hairline stays similar but thinner. With men, the hairline recedes, just like in me, goes up a little bit, the temples go up more, and that's the typical pattern. If you do give a woman testosterone for some reason, she can get male pattern baldness too, just like men can. And we occasionally will see that in bodybuilders or something, that are ladies that are taking testosterone, which they probably shouldn't be. So with Sean here, we're going to do at least one treatment. These treatments are injections of platelet-rich plasma. They work a little bit better in the ladies than in men, but they work in both sexes. In most men, I try and talk them into at least a 3-pack. I find that if you have an area that's totally free of hair, like the temple here, this therapy is not very effective at putting hair there. But if you have areas with thin hair, such as near the temple and at the hairline and just behind it, those areas are much easier to get decent hair growth in. So we're going to go ahead and we've already drawn his blood, we've processed it, and it will look, it's not bloody anymore. We've taken most of the red cells out. It's platelet-rich plasma. It has growth factors in it. It'll help his hair grow. So we'll go ahead and inject. We intentionally bend these needles. You can see that this needle is not straight up, it's bent. That's because if you've got it straight, it's you're kind of going in and catching the skull. You want to be a little bit more superficial, about 1 millimeter or 2 deep when you inject. How much does that hurt, my friend?
I'd say 3 on a scale of 1 to 10.
3? Okay. And you'll see a little bit of bleeding as we do this. It's not bad, but there's some. And I like to put stuff right along the hairline, because that's where people see his face the first when they meet him. So if you have more hair there, it kind of hides what's behind. And so the most important area, I think, to treat is the hairline. So once again, I'll start near the hairline here, which I think is a reasonable place to go at it. And you'll notice that these pokes are 1 centimeter or 2 apart. And does seem to make a difference when people have had some of these. Okay. We're done. How'd it go?
Seemed to go well.
All right. So once again, you think your pain went up to maybe 3 or 4 out of 10?
Yeah, I'd say each poke was different, between a 2 to a 4.
Yeah, I'd agree. I've had some of it done myself, and it's highly variable, poke to poke, depending on where the nerves are.
Exactly.
You did great. Thanks for helping. This is Dr. Van Rieken at Reno Sparks MedSpa signing off. Stay good looking.